All right, this is Jules Stewart. Jules, do I have your permission to use you as a case study for my Kinesiology 6302 course?
Yes.
And do I have your permission to videotape this assessment and share it in my Kinesiology 6302 course?
Yes.
Great. So this is an initial assessment for an injury that you sustained. What is your specific health problem that you're having?
Left shoulder pain. I haven't gotten a diagnosis, but left shoulder pain from an injury.
And how are you feeling about that? Has it limited any of your activities?
Yeah, I can't, or it hurts to lift weight, go surfing, and play soccer. I'm a goalkeeper, so I dive on it, but I'm having trouble doing those things. It's kind of a bummer.
So what would you say your kind of goals and objectives will be for our post-rehabilitation shoulder program?
I'd like to get back to those things and be able to do those things without any sort of restriction or worrying about it.
Okay, great. So one of the things that I like to do with every client that I first work with is a physical assessment, two of them. I do a static postural assessment and a dynamic postural assessment. So what I'm going to have you do is go ahead and face to the side so I can see you from a lateral view. And in this lateral view, I want to look at the entire musculoskeletal system. The National Academy of Sports Medicine has a protocol in which I'm going to follow. And so pretty much what I do from this side view is look at the head, cervical spine, scapulae, thoracic spine, lumbar spine, pelvis, hip joints, and ankle joints. And what I'm looking for is to make sure the center of mass is kind of a straight line through that area. Okay, great. And then go ahead and face the wall in front of you, or sorry, behind you. Yeah, got it. And from this back view, again, I'm going to kind of take inventory of what the head position is like, shoulders, scapulae, thoracic and lumbar spines, the pelvis, hip joints, and the lower extremities. Excellent. Okay, good. And then go ahead and face me again. So this kind of transitional dynamic postural assessment is called an overhead squat assessment. Again, one that the National Academy of Sports Medicine has put out. And so what I'm going to have you do is stand with your feet shoulder width apart, toes facing forward. I'm going to have you slowly raise your arms up overhead. Let me know if you feel any pain throughout that range of motion. Good.
A little bit on the way up.
On the left side?
Yeah.
Okay. Can you point that pain out for me?
It's here. It starts about here.
In the anterior shoulder?
Mm-hmm.
Okay, good. So adjust your position if you need to, if that pain becomes unbearable, okay?
Okay.
Or if it intensifies during the overhead squat. So I'm going to have Jules do 3 overhead squats, 1 facing me. Actually, let's do 4. 2 facing me and 2 facing the side. So go ahead and go through, going to a squat as low as you can, and then coming back up, good, perfect speed, and then one more time, about down 2 seconds, 1, 2, and then up 2 seconds, 1, 2. Great, and then go ahead and face that left wall again. So 2 times from the side. Again, I want to make sure that in the view I can get her entire system. Okay, so go ahead, 2 squats. Good. Nice speed. And then one more time. Good. Thank you, and then you can relax your arms. Perfect.